For joining us. Absolutely appreciate it. Sophia's done a ton of research and every week has done a ton of research. So thank you so much for helping keep us up to date. For folks who are just jumping on, forgive me if this is something you've heard from me multiple times. We're gonna let Sophia go through her entire presentation and then we'll have a question and answer period afterwards. If you have any questions during the presentation, you're absolutely more than welcome to throw that into chat. I'm sure everyone's pretty aware of how to work this crazy Zoom thing, but just in case, for your convenience, chat is here, so it should have lit up for you. If you'd like to ask a question anonymously, you're more than welcome to private message me, Maud Haney, and then I'll ask that question for you. Thank you everybody for muting yourselves. How fabulous. Don't even have to do anything. I appreciate that. Yeah, so we're gonna get started. And again, if you have any questions, please share them in chat and we'll answer them at the end. So Sophia, thank you so much for jumping on. I appreciate it.
Thank you too, Maud. And thank you everyone for joining us yet again for one of our weekly updates about the coronavirus situation as it relates to small businesses. Today we're going to be talking about a few things. We're going to be talking about the emerging state framework for the reopening for the state of Oregon. We're going to talk about how employers and HR departments can help businesses get ready for reopening and for the various levels of compliance and new regulations that are going to be coming down the pike. And I am also going to start out by giving you a CARES Act update. Thank you for being here. So next slide, just briefly about the Caputo Group. We are the Caputo Group. We offer complete support services for your small to mid-sized business. We help you with human resources, compliance, liability, and things like payroll and benefits so that you can focus on the reason that you went into business to begin with and to focus on your craft. In addition to that, we also support the businesses and business sectors that we work with through activities like this, value-added activities focused on keeping you up to date with the changing business realities. So on the next slide, we have a brief update on the CARES Act. And those of you that have been joining us for the last few weeks, we've been together talking about the CARES Act, the different types of financial incentives that have been mandated by the federal government to help small businesses in the midst of the coronavirus economic fallout. We've tracked the EIDLs, which are the Economic Injury Disaster Loans, and the PPPLs, the Paycheck Protection Program loans, which are two main ways that small businesses could get aid from the federal government. Last week, we had a reload of the CARES Act, which had previously run out of funding. And it was reloaded last week with the Enhancement Act, which appropriated more funds for both programs. So as of this past week, the Economic Injury Disaster Loan Program administered by the Small Business Administration is now closed to new applicants, except for applicants in the agriculture sector. And as I recall from last week's presentation, about $28 billion was appropriated for the agricultural section. So if you are in that industry, you are still eligible for the economic injury disaster loans. Figures as of this past week, about half of it has already been spent. Half of the money that was appropriated in new funding for the Paycheck Protection Program, that was already processed. And then there are a couple of, well, there's this new rule here. There's the new IRS rule, and it's in regards to double dipping. So for the forgivable expenses with the Paycheck Protection Program, you don't have to pay federal taxes on that upfront, but then you cannot deduct those forgiven expenses on the back end. So this was put into place to prevent double dipping, but the last research that I did on it yesterday mentioned that there is talk in Congress about fixing that. So what I've attached here for you, and this is all going to be available to participants on our website at the end, I've attached a really good yet short article about that new IRS rule from the National Law Review. So if you want to read up on it, you can click on that link. Some of the congressional actions that are in the works, and we don't have a time frame on that yet, but this is what is being talked about right now. There's talk of appropriating more funding. There is talk of an extension of the 8-week forgiveness window for the loans, and there's also talk of easing the 75% payroll rule. So if you remember, businesses that get the Paycheck Protection Program loans, it is forgivable if 75% of it is used for payroll. So I will keep my ear to the ground on those details, and I will be updating the community in our future webcasts. So moving on to the next slide. The topic we have all been waiting for. When and how is Oregon going to reopen? And there's quite a bit of information here. I have done my best to put it into outline form for everyone. But essentially, here's the overview of the strategy. There's 3 main areas: testing, tracking, and terminating. So with the test category, the main points are that we need to reach a level where there is adequate testing for every symptomatic Oregonian, and that now includes even people with mild symptoms. Another goal is that the tests would have a fast turnaround, that the results would come in between 48 to 72 hours. And then we also need to reach a level where we have surge capacity, meaning that we have the ability to test many people quickly. And that's especially true for places like nursing homes and group living situations, like agricultural worker quarters, fishing boats, prisons, group homes, that sort of thing. Next in the strategy is tracking. So there's a few things that are going to be coming down the pike. One of them is widespread voluntary representative sample testing, and mid-month, the governor's office is going to be sending out notices to Oregonians. What they want is they want 100,000 people to volunteer to be sample tested and then tracked. And that is going to be performed and managed by teams of people that have yet to be put together, who are called contact tracers. And there's going to be more on that later on in the presentation. They have proposed a mobile app to facilitate the tracking and contact IDs. And then also they need to increase Orpheus capacity. And Orpheus is the state's public health database, so that figures can be collected rapidly and then reported. The last category is terminate. So We need the ability to quickly isolate the ill and quarantine the exposed. We need to be able to provide support to the isolated and the quarantined. We need the ability to surge ICU capacity if needed, if there is a rebound or resurgence of the disease. And then we need an expansion of paid sick leave and unemployment insurance to shore up the livelihoods of the affected. So on the next slide are some of the strategic partnerships that Governor Brown's office has formed in order to put this plan forward. And she calls the first one a game changer. So it is a partnership with the Oregon Health and Science University, with the state of Oregon and the School of Public Health at OHSU, which will be conducting this statewide COVID-19 study to get us real data and numbers on the infection rate, on the way that the disease spreads, and help in locating hotspots. This data will also help us mitigate risk and prepare for possible surges as the state economy begins to open. So we need to know that. We need to know that with the steps that we take to reopen this economy, that the very real possibility of a resurgence is with us the whole time. So protocols will need to be in place for what to do if and when that happens. The Oregon State Public Health Laboratory is another partnership. It's a central testing agency, and it's going to serve groups like the residents, staff, or family in residential care like nursing homes, school, migrant worker facilities, tribal communities of color, and other at-risk communities. And then the various partnerships that have been formed with hospitals and local care and testing providers. So these are all institutions here like Asante, Kaiser, Providence, and you can read the rest of the list, where testing already is available, and it will expand as the plan moves forward. So on our next slide, these are the goals for testing, and the Oregon Health Authority has stated that in order to move forward with reopening, that we need to have a minimum of 30 tests per week performed per 10,000 people. And this is just for regular diagnostics. So if people are having symptoms, they go in to get tested. This doesn't include the 100,000 people who will be tested for voluntary surveillance. According to the Oregon Health Authority, there is sufficient capacity in the state to achieve this. And the goal is a minimum of 15,000 statewide tests on a weekly basis. There are new testing guidelines now so that more Oregonians can be tested, and this includes asymptomatic people or mildly symptomatic. So they've really eased the guidelines on that so that we can get a handle on these numbers. That URL is a link to those new testing guidelines. So if you're interested in having a look at that, you can use that link right there. The 600 new public health personnel that I talked about will be 15 of these workers per 100,000 people, and these will be the people who are out there testing and tracking and doing the contact tracing for positive cases and those that have been exposed. Another goal is to shore up the state's test and personal protective equipment stockpile, again, to deal with a possible and or probable surge. Then we've got the voluntary representative sample testing project. And then the goal is to establish accurate data for at-risk communities, and particularly the tribal communities and communities of color, because they seem to have higher incidences of this disease. So in the next slide, I just want to show you how the state coalition has divided up the state. It will be in testing regions, so you can have a look at these different regions, and I have no idea why there isn't a region 4 or a region 8. That's beyond me, but that's how they set that up. And you can see where your county falls within those regions. And down there, I've included a link for the strategic testing plan for Oregon and how you can track and follow your region's readiness program progress there. So again, this is all going to be available to everyone after the webinar. You can download these slides and you can refer to them. And I will also be posting updates on all of this information on my Sophia Blanton with the Caputo Group Facebook page during the week. So on our next slide, this is the biggest hurdle that we need to jump in order to reopen the economy. So these are our broad contact tracing goals. First, we have to find, test, track, and help all who come into contact with someone who is tested positive. The priority will be on counties with the lowest test rates, highest case count, or those with barriers to timely testing, like, you know, they might be in a really remote area or they might have other barriers. There is the voluntary mobile app to help track the contacts of infected and exposed Oregonians. And then they are wanting to test up to 200 surveillance specimens, and those are the voluntary ones per week, from patients with influenza-like symptoms or people without symptoms, asymptomatics. The case investigators, so that's that army of 600 people that the state needs to work with this. They are going to be visiting people electronically over Zoom or over the phone. They will contact people to collect information on their symptoms, the severity of their symptoms, other health data, what type of occupation that person has, other demographic categories, and they are going to be asking those people for lists of all the people the person has had contact with. And then the teams will be facilitating testing, and they will be checking in daily with those patients for 2 weeks. So this broad contact tracing profile, as has been expressed by Governor Brown's office, must begin prior to the easing of physical distancing. So on our next slide, we have the thresholds to reopening. So we talked about the broad contact tracing goals, but we also need the data system to handle the expanded contact tracing. The goal for that was April 30th. We need a staffing plan and recruitment of those community health workers. So that's supposed to be instituted today, and I will check up on that again. There was no information on that when I checked up this morning. So we need the 600 more team members needed to work with the active surveillance and the contact tracing. We need call centers, and then they're also going to be asking for volunteers. In the next bullet point there, they want to develop contact tracing training models for this workforce, and the goal for that is May 18th. So I don't know. Information changes on a daily basis. It changes on a weekly basis. I will keep tracking this. I know that what everyone would really like to see are some hard dates. When can we open? But none of this is going to work along those lines. It's going to have to really be a flow chart. If this, then that. If we achieve, then this. And so May 18th is their goal, to have the training modules ready. And then we'll see how long it takes to get this workforce trained. And then, of course, as we stated last week, they're looking for a consistent downward trending caseload for the last 14 days. And again, that's going to happen county by county. So on our next slide, we have some key questions for businesses. Number one, are you in a community that no longer requires significant mitigation? Or, meaning, is it no longer essential businesses or essential workers? It's no longer restricted? Number two, are you going to be able to limit non-essential employees to those from the local geographical area? So it makes sense that, you know, even business travel is not to resume yet. Can you resume your operations with non-essential employees who are from your local geographical area? Next one, do you have protective measures for employees at higher risk that can minimize contact? So can you still prioritize teleworking? And then, are you willing to comply with the implementation of the safeguards to stem the spread of the disease? So these guidelines are now popping up in gubernatorial work orders all over the nation and OSHA regulations. And it's a pretty comprehensive document, but you can download the full OSHA guidance at that link, which will show you, you know, guidelines for, how to arrange your business so that you can reopen safely. On the next slide, so what to do while we're still in limbo? Okay, you can definitely start moving towards reopening by taking some of the following steps. It has been recommended that companies designate a COVID-19 coordinator, someone who monitors federal, state, and local news, someone who liaises with local health authorities and government agencies and keeps everyone updated on the situation. That employee can also coordinate the reopening protocols that you eventually adopt for your reopening. And it's been recommended that prior to reopening, that companies have health monitoring protocols in place, enhanced hygiene protocols in place, social distancing protocols in place, and strategies for adjusting the workspace physically, adjusting how supplies and equipment are handled, and working hours. And now this last one, it wasn't an official suggestion, but I highly recommend it, that everyone gets in contact with your county board of commissioners, because they are the people who are going to be drawing up the proposals and petitions for permission that each county is going to be submitting to the governor for reopening. So they do have regular calls, like for example, for Jackson County, I've signed up to get on their call tomorrow morning. And they are the people that are making the decisions for your counties. And so they will be able to give you current developments on your county's reopening strategy and progress. So on the next slide, we have some details about worksite health monitoring. And yes, employers can measure employees' body temperatures. There's been talk of new screening options and actual outsourcing providers coming online soon. So companies that can actually take that off your hands, and I will keep my ear to the ground on that and let you know as that emerges. Your workplace screening, if you choose to do it, must be consistent with the Americans with Disabilities Act. And there are actual workplace COVID-19 testing guidelines that were published by the Equal Employment Opportunity Commission that you can download at that link right there. Employers are going to need to be careful to notify all employees in advance of any screenings that take place. Make sure that it's clearly communicated to employees that the purpose of the screenings is to monitor COVID-19, not to determine any other illness or disability. And also to reinforce to employees that the screening is not a substitute for an official diagnosis. The last bullet point talks about procedures and best practice for worksite employee testing. Personal protective equipment, physical barriers, privacy, and logistics. And you can download a guide to testing employees for COVID-19 right at that URL there. It was compiled by the Fager Drinker Law Firm, and that's been one of my big sources for this week's webinar. They've really gone in depth with reopening protocols for businesses. So it's a really good source. Please go ahead and use that. On the next slide, if an employee should test positive, then obviously they should stay at home. And employers need to have developed an action plan for this eventuality if someone eventually does test positive. It's recommended that you have an emergency communication channel for employees. And it's also highly recommended to maintain confidentiality about any eventual employee illness in compliance with the Americans with Disabilities Act. And that all of it should be very carefully documented. And I have included for you, once again, the request forms and designation forms for paid sick leave. And that is something that was compiled by the Pierce Atwood Law Firm. And those are available to you right there at those URLs. On the next slide, so the question of enhanced hygiene protocols, and it's really going to vary industry by industry and business to business. But a deep cleaning of the entire workspace is recommended prior to your employees returning to work. And then it's suggested that employers institute ongoing cleaning intervals. So depending on the type of business that you have, weekly, daily, hourly, or even in between clients, depending on the business. So, you know, restaurants and personal services, for example, are some businesses that will have to adapt to most frequent cleaning adjustments to make sure that after one client or set of clients leaves, everything is sanitized. So cleaning is going to be a big thing. It's been recommended to institute more hand washing and sanitizing stations and to have regular washing intervals. So to actually remind your employees on a regular basis to wash their hands. The next one is kind of a no-brainer, but it's something that is so ingrained in our culture that we don't even stop to think about it. No sharing of food You know, definitely no passing around bags of chips, anything like that that other people can touch. Employers can require personal protective equipment. And this is an area that employers need to start thinking about right away, to develop a strategy either for providing it or for requiring it, and then enforcing its use, which can be tricky because there's already a lot of resistance to mask usage. But whatever the employer decides should be very, very clearly communicated to all employees. The next item is proper signage and communication of hygiene protocols. So we really are going to have to reinforce that from a lot of different angles. Telling them, putting it into a company email, working it into an addendum into the employee handbook, signs, communication, reminders, that sort of thing. There is a link there for from the Centers for Disease Control for sanitizing guidelines for reopening businesses, which is very, very helpful. And then last of all is personal protective equipment for maintenance and for food staff. And so especially for maintenance workers or people who are going to have to handle garbage, it's, you know, depending on the type of business, masks, gloves, gowns, that sort of thing. On the next slide, we have the physical distancing guidelines. And I know that this is a whole new challenge. We really have to manage our expectations, and we have to balance the reality of COVID-19 with the need and desire to reignite productivity. But it's a reality, and it's here with us, and hopefully it'll only be with us for a short time, and we will be over this hump, and we can go back to, well, you know, people say that there's going to be a new normal, so whatever that's going to look like. However, employers will have to comply with federal, state, and local requirements. A lot of those are not clear yet. We are still waiting on guidance. And some of that guidance is going to be compiled with sector-specific bodies like the Restaurant Association or the Salon Association. So the governor is working together with these groups to develop these forms of guidance and help make that clear. So again, I know that people are going to be excited to get back to work. They're going to want to fist bump or high five or hug each other, but it's been recommended that non-touch forms of greeting like waving become our new normal. It has been suggested that lunchrooms or time clock stations, you know, any place that people tend to congregate within the workplace, that they're closed or modified to be able to comply with physical distancing. They're trying to not say social distancing anymore. They're trying to say physical distancing now. So another suggestion that has been made is no shared equipment or supplies. So to consider appointing a person to be your point person for supplies or equipment or operating, you know, like the copier or the printer, that only one person operates that they have PPE on, and that they then disperse, you know, copies or those types of things. Physical meetings and conferences are probably still going to be a big no-no in this next phase, this next month. So it has been recommended that we still prioritize electronic meetings like this one here over Zoom over the physical meetings. Rethinking customer delivery and pickup methods in order to avoid lines or bottlenecks, And it's been suggested that companies really seriously think about implementing contactless payments. It's been recommended that working hours be rethought in ways that could stagger shifts or alternate days in order to reduce density of occupation in a building. And then there's been all kinds of ideas that have come out about rethinking workplace layouts, ways to create more distance in the workplace, to use barriers, removing extra chairs, anything that discourages loitering, rearranging the desks and tables, and developing plans for avoiding crowding or bottlenecks in elevators or hallways. So we know that these are things that are new, they're just now coming out, and we know that companies are very creative and ingenious, and so we encourage people to share their strategies and how they have complied with these new regulations. We encourage you to share that and to share it. And at the end, I'm going to give you a link where you can share with us what's working for you, or what are some of the challenges that you're coming up against as this new phase rolls out. So in the next slide, we have some considerations for HR. It will be important for everyone to continue to document the steps that they take, not only to provide evidence of compliance, but also to provide evidence of non-discrimination. It's been strongly suggested to write an addendum to the employee handbook that carefully lays out your company's new protocols, and to offer a training on that for which employees will sign off on. So employees will have to certify that they understand the new protocols that have been laid out. And then to develop detailed policies on what to do when an employee becomes symptomatic, tests positive, or is potentially exposed. And last of all, the policy should inform all employees prior to their return of all the safety measures that will be in place in your company, like temperature monitoring, hand washing, mask, PPE usage, or the ways that the hours may have been staggered, or physical changes to the environment. So on this next slide here, great. So this is just a little wrap up from the CDC about reopening workplaces during the COVID-19 pandemic. So it just kind of summarizes what we talked about today. The 3 questions that you should consider prior to reopening, then your safety recommendations, and then the monitoring. So it's just a recap of what we talked about in this presentation today. On the next slide, we would love to keep the conversation going with you. So we'd love to hear about what's working for you, how you're adapting, how your business is handling the reopening. And the link there is my Facebook page, Sophia Blanton with the Caputo Group, where I'm going to be conducting surveys and sharing resources and new guidelines as they come out. So next week, we're going to be continuing the updates with everything new that's come out from the state and from the federal government. And we will give you updates on more developments with the CARES Act, and as always, sharing new resources with you. And our last slide. If you would like to have a free consultation on how to handle the mandatory employee sick leave, please visit us at our website, which is provided there for you. And then our presentation today will be available at the second link. And that's all for this week's edition. I know it was a lot of information. I want to thank you all for your attendance and for your attention. And Maude, if you'd like to open it up for any questions or comments, let's go for it.
Sophia, thank you so much. That is so much information to digest, and I do absolutely appreciate you just combing through that and pulling out the salient points for us. Very much appreciated.
A lot, isn't it? Yeah.
Oh, it's a lot.
And down the pike that employers are going to have to deal with real soon. So yeah.
Absolutely. It is exciting to see there's some forward movement though. So that's really heartening. We do have a request. Would you be willing to paste your Facebook link into chat so that people can save that?
Oh yeah, sure. Let me just grab that real quick.
Thank you.
Sure.
And as you're doing that, we did have a question, and I want to double check that it was answered completely. So the person who asked this, feel free to unmute yourself and ask it. But the question is, can you clarify what health monitoring protocols you would suggest? Are we taking temperatures or vital sign monitoring of our employees? Does this person feel like their question was adequately answered? Or did you have any kind of anything to add to that?
Well, what I've seen so far is temperature taking. Now there is a link there. Let's just go back to that link. Worksite health monitoring. Okay, so there is the Equal Employment Opportunity Commission testing guidelines, which could help with that. And then the guide to testing employees for COVID-19. So if you go back to that page.
Which page is that I can go to there for you, Sophia?
Health monitoring, I'm not sure what page number that is.
What's it called?
Worksite health monitoring. And here is the Facebook link for everyone.
Thank you, Sophia.
Sure. Please feel free to join me there. I'm constantly sharing little bits of updates and research that would be helpful. Okay, great. So there we are. We're on that page again. Like I said, what I've seen is I've seen that employers can measure the employee's body temperature. They're still, they're still issuing guidance on, what that's going to look like. And there's going to be, like I said, new screening options, and even some outsourcing providers are going to start to come out that will be able to come to your business and do that for you. But I think that the URL down there at the bottom is a really, really good one. The Guide to Testing Employees for COVID-19. So that's a really good resource for that question. Crystal, does that help?
Fantastic.
Yes, you got it. You got it right on. Thank you.
Sure thing. Okay.
Does anyone else have any questions or strategies that they've been employing that seem to be working really well? And everyone has a very unique situation, and sometimes it's great to talk it out with some really smart people that we obviously have. There's some great resources on this call right now. So if you do have a special situation that you're trying to kind of work through, feel free to bring it up.
It's nice to see People joining us. Glenn, welcome. You said you'd be with us. It's great to see you here. Welcome. Welcome to everyone.
Well, fantastic. Give a few more moments for any questions. I think sometimes it takes a moment for your brain to formulate them. But thank you so much, everyone, for joining us today. Sophia, again, thank you so much for kind of digesting this information for us. We absolutely appreciate it.
Hey, Maud, this is Hunter.
Hi, Hunter.
And thank you guys again. Excuse me. I did want to expand on one thing that came up in the presentation that Marilyn did yesterday that I think is important, is that the concept of taking an employee's temperature is only being allowed as part of a protocol that has to be written in regards to COVID-19. You're not allowed to do a medical exam on an employee outside of the COVID, I don't know if you want to call it, just laxing of that rule. So that what they're allowing is for you to take their temperature is not, is otherwise an HR violation for an employer to do any kind of medical exam on an employee. So it needs to be clear that that is something that is only being allowed with some written protocol that has only to do with the COVID-19.
Thank you, Hunter. That is a good point, and I don't think that we can stress this enough, because I can imagine as we're taking temperatures and really getting into that folks may lose sight through all these complications of existing very important employment laws.
That's why on that slide too, it mentioned that you know, you need to be very, very careful to communicate to your employees if you do choose to do workplace temperature testing, that this is strictly because of COVID-19 and not because of anything else. And there has to be documenting and full disclosure.
Any other comments, questions, or just if anybody hit on a really brilliant way to rearrange your workspace that other folks could benefit from emulating, please do share. You're more than welcome to unmute yourself and jump on in. Well, thank you guys so very, very much again for joining us. This will be available on the Caputo Group website, the slide deck, as well as the recording. So if you need to go back for any of the any notes. And again, thank you, Sophia, so much for all of your information. And I hope you guys have a very healthy and safe day. Thank you.